Bismillah.
Coming to the silence. I rise to report that report was like the Select Committee on Health, Disaster, Humanitarian Relief to Common Business.
Thank you very much. Hello members, good morning everyone. Hello members, it is reported that a quorum exists for the Select Committee on Health, Disaster, Refugees and Humanitarian Relief to commence business. Those in favor, please say aye. Aye. Those not in favor, please say no. So the ayes have it. So we move forward. I think we all have a copy of the agenda. Is there anything that we need to address before we start the meeting? If there is none, can I have a volunteer to please move that we adopt the agenda?
I rise to move adopt the agenda.
Any second?
Second.
Okay, thank you. It is moved and seconded, so therefore the agenda is adopted without amendments. So thank you very much, honorable members. Again, once again, good morning, honorable members. Good morning, our esteemed stakeholders from the Association of Public and Environmental Health Officers, and of course, from the National Association of Gambian Nurses and Midwives. We welcome you all to this meeting. But before going further, let's start with introductions. As you may know, some of you might know some of us personally because we are representatives of the people, but by way of procedure and processes, it is incumbent upon us to introduce ourselves. Starting with my humble self, I am Honorable Amadou Kamara, the member for Nyanija and the chairperson of the committee.
Good morning, I am Honorable Modulamin Biba, member for Banjul North and the vice chairperson of the Select Committee on Health.
Honorable Abdullah Sisi, the leader and member of this committee as well.
Assalamu alaikum. I'm Honorable Padem Bosane, member for Foji Bondali and part of this committee.
Yes, SMS.
My name is Dr. Yahya Mohamed Ba, Dr. Morris Specialist.
I'm Sarah Okoyan, Secretary of the Committee.
You can also introduce yourself.
Okay, good morning, honorables and my colleague. My name is Baka Sana, the Vice President, National Association of Nurses and Midwives Association.
Good morning, honorables and my dear colleagues. I am Noah Fofana. I'm the President of Association of Public and Environmental Health Officers of the Gambia.
Good morning, honorable members. My name is Nafi Jata. I'm the Assistant Secretary General of the National Association of Gambian Nurses and Midwives.
Good morning. My name is Ami Bob. I'm the Associate Secretary to the Association of Gambian Nurses and Midwives.
Good morning. My name is Samba Boy, the Secretary General for the National Association of Gambian Nurses and Midwives.
Good morning. My name is Abubakar Cham, the President of the National Association of Gambian Nurses and Midwives.
Good morning. I am David Day, the Auditor General of Gambian Nurses and Midwife Association.
Assalamu alaikum. My name is Omar Balde. I am the Information and Public Relations Officer for the Gambian Nurses and Midwives Association.
Good morning, everyone. My name is Mohamed Toure, Assistant Treasurer, National Association of Gambian Nurses and Midwives.
Yes, you start from here again. Fatma.
Okay, thank you for making it very easy for me. I am Fatma Singate, the Treasurer for the Association of Public and Environmental Officers, the Gambia.
Good morning. I am Dusaho, the Secretary General of the Association of Public and Environmental Officers.
Good morning, everybody. I'm Vivian Siogogunan. I'm the Assistant Secretary General of the Association of Public and Environmental Officers, the Gambia.
Good morning. I am Mohamed Keita, the Assistant Social Secretary for the Association of Public and Environmental Officers, the Gambia.
Good morning. I am Dawo Bakari, Social Secretary for Association of Public and Environmental Officers.
Always known as what? Thank you very much. I can see that today we are in safe hands. And David, you are welcome.
Thank you.
Some of them were asking, is this the OIC for circular? Yes, you can fully remember. Yes, thank you very much. We are definitely in safe hands today, in the hands of veteran nurses, and of course veteran public health officers. So I think today my call, I will say bye-bye to my call, and all the others who know that they are suffering from minor ailments. So thank you very much, and then we welcome you once again to our meeting. As you are aware, and as you might be communicated in your summons to appear, this is not a meeting whereas you are called to come and give testimonies and so on. If that was the case, we will definitely make each one of you to take oaths before you are able to speak before us. But as you are aware, it's a familiarization meeting, and of course for us to discuss on how you operate in your various associations, what you do for the people of the Gambia, because we understand you are all associations that are directly linked or directly under the Ministry of Health. And then the Ministry of Health being the apex body, we also perform oversight over the Ministry of Health. So we deem it necessary to deal with you since you are the service providers, and we will stop from here only. We will also have an interface with the other cadres, because we understand the Ministry of Health have different cadres. And then it is always important to talk to you since you deal directly with the people that will represent the people of the Gambia, whom you know that whatever that is done at the national level, be at the ministry, be at the National Assembly, the benefits or whatever that is to be done, it is to be done with them and to them. So it is important we talk to you. How are you cooperating with your tax as far as you are established and organized bodies with clear mandates, of which is just to better the lives and livelihood of the Gambian people, and that is to our interest. So you are definitely in the right place and in the right footing to tell us whatever that you feel it is important for us to know as the apex body when it comes to decision making, when it comes to health and welfare issues of the people of the Gambia. So we want to once again thank you so much. Yes, what is
it seems we have two associations.
Yes.
Maybe during the deliberation we can have one today. I know the sitting arrangement is a bit together mixed, so that we understand. Maybe public health can go first and later we can.
I think I'm the only one on this side. It's on the public health, so if I can move there, if that is okay.
Yeah,
it's left to the committee. It's left to the committee, but I think that because mostly our witnesses should be on the left and honorable members and SMS should be on the right. But due to the circumstances, that the hall is a bit small and we don't have enough chairs, that's why we said some of you can come to the right side. Unless probably we will not have a full committee representation because other members are also in other committees, others have gone on tour and so on. So if it is okay, you can shift here. You can reserve the seat if another honorable member come. Yeah, now the president of the nurses, you can move this seat can be reserved. I think that's fair enough now. Now we have the public health officers on this side, honorable members. We also have the nurses on this side. Yeah. So thank you very much. So now let's move on to agenda number 3. That's familiarization meeting and discussion on issues related to their work. We will first of all start with the nurses. And basically, as I said, what we want to hear from you is what is your mandate, and then what are some of the activities that you do, and what are some of the challenges you are facing, and how do you think the input of the National Assembly can definitely better the work that you do. Because as I said, you deal directly with the beneficiaries, you deal with the end product. We approve the budget, the Ministry of Health implement the budget. The Ministry of Health come up with policies, we also add value to those policies. We make laws, the Ministry of Health and others implement them. So we want to see, we want to know just how are you dealing with these issues at your workplaces. Because also having health background, I know many of you, you are stationed in the various facilities, some of you are at various units, even some of you are even outside the Ministry of Health. But you are proud of your profession, you are proud of your cadres, that's why you are organized, you form these formidable organizations, associations rather, to fight for the cause of the people whom you know that they are doing, or they are dealing directly with the lives and livelihood of the people of the Gambia. So on that note, the floor is all yours, Mr. President and your team. We choose who will talk. If you want, you can talk only, or if you want, you can have a good word. You are reminded that we only have 2 hours for this interviews. So one hour for the nurses and another hour for the system. And then I may stop you at any moment if I feel that probably we are going beyond the time. So make the best use of the time you are given. Tell us anything that you feel that is important for us to know. Don't hide anything, because this is the National Assembly. Tell us anything, whether the good or the bad. We want to hear everything. So thank you very much. The floor is yours.
Good morning, Honorable Chair. Good morning, honorable members. Good morning, subject specialists, and good morning, colleagues and the media. I'm Dr. Babu Cham, the President of the Nurses and Midwives Association and a lecturer at the Gambia College School of Nursing and Midwifery. The National Association of Gambian Nurses and Midwives is an independent, non-partisan and non-governmental organization, Nurses and Midwives Association, that was established and affiliated to the International Council of Nurses in 1965. The association is an association of nurses and midwives practicing in the Gambia and function under the principle of non-profit making and non-discriminatory. The purpose of NAGAM is to represent, protect, and promote the welfare of nurses and their interests of nurses and midwives nationally and internationally. The association also strives for excellence in healthcare delivery in the Gambia by advocating and raising awareness on the role of nurses and midwives and educating the public on pertinent health issues, as well as promoting professionalism and ethics and code of conduct of nurses, and trying to rebuild and rebrand the image of nursing in this country. We took over office in July 2022, and then since we took over office, we have embarked on a series of activities. One is the increment of the membership to about 40%, which we were awarded a bronze medal by the International Council of Nurses in Canada, Montreal, in July. It was only the Gambia from West Africa who bagged that award among all the countries that represented more than 130 countries, members of the ICN. We also developed a 4-year strategic plan that shaped our direction and our focus, and then we have started even implementing the 4-year strategic plan. We also came up with a capacity building project, because our members does not only include nurses, but also include nurse attendants. These are people who are trained on the job or receive minimal training, but they offer services to the public. And we deem it necessary that hence these people are not trained professionally, and then they are working for the public. They are offering services, and we deem it necessary to build their capacity. Through the minimal funding contribution which we are doing, which is $100 for every trained nurse monthly, and then $50 for nurse attendants, we are taking about over $600,000 to train 40 nurse attendants to become second-level nurses, that is CHN and SES. Already, the interviews have been done. Lists have been selected. About 90 of them are selected, but because of limited funds, we are only going to sponsor 40 of them, and we are not going to sponsor them 100% because we will not be able to meet the cost of the training. But we are going to sponsor about 60% also. So for a period of 2 years, and then when they are complete, they will be qualified nurses and then working for the public. So we are stepping in for government to build capacity and increase the human resource. And then also we wrote to the Ministry of Local Government and Land and made several follow-ups to acquire a land. Unfortunately, we couldn't have any positive feedback. We wrote to Social Security. I went personally to AMRC to inquire whether we can get land, purchase land from them. But unfortunately, we couldn't, and then we bought a land now. And then we are working on it for the final transfer of documents so that we can start something. We celebrated the International Nurses and Midwives Day, which is May 5th and May 12th. And apart from organizing press conferences and marches, we decided to go into the public, and then we went to Fajikunda, Dumus, and then organize free screening exercise whereby we bought our own drugs and then we go screen people and then give them free treatment, because that is part of our social corporate responsibility to give back to the nation. There are other, we have other achievements like sensitizing the public using the media, both television, radio, and the print media, on our role as well as pertinent health issues. We have attended also the International Council of Nurses Conference in Montreal in Canada, the President and the Secretary General. The President also attended the ICM, that is the International Confederation of Midwives Triannual Congress, which was held in Bali in Indonesia. We also attending a training of nurse leaders. It is a project called Leadership for Change project. Last year we went to Kenya for the first leg, and this year in Salawa we were going to Kigali for the second leg. Although ICN is funding, but we come in to do extra funding with that. They are funding our trip that is going and coming, and then also our feeding and accommodation. But the rest is the association is responsible. And then we also attended, because it was called for the ICN to attend, nurses to be included by the Ministry of Health in their delegate to attend the World Health Assembly, where health matters are discussed. But unfortunately, the Ministry of Health couldn't, according to their budget was tight, they couldn't include a nurse. So we decided to fund the trip of one of our members to attend that important World Forum where health matters are discussed. The challenges. One of the challenges is motivation. In terms of health, to be quite frank, the Gambia is sitting on a time bomb like any other African country. The cream of the health professionals are going to the West, and the rate at which Gambian nurses and other health professionals are going is alarming. It is quite alarming. Every day nurses are leaving this country and going. We cannot stop them from going, but we have to put a mechanism whereby those who want to stay will be motivated to stay. And those who are going, if they go, they will be replaced. Obviously, the schools have increased their intakes. In the past, the School of Nursing would have only taken 50 at maximum, but now we are going to 150. School of Public Health is taking up to 100. And then, but with all these intakes, it cannot fill the gaps. If we are, you have a bucket and then you are pouring water and the bucket is already there as a hole, no amount of water will fill that bucket. And then he is here, is my witness. When we went to Canada, when UK presented, they said they need 48,000 nurses plus. Where will they get it from? From Africa and Asia. Canada said they need 43,000. They have vacancy of 43,000. And then where will they get it from? Is here. In fact, some of us who went, we went on behalf of the association, but people who went on their own decided to stay. And then the governor, the Prime Minister of Canada came to the gathering and said, I have instructed all my regional governors and everybody, government to expedite the process, paperwork for foreign nurses to stay. So where are we? It is pathetic that if we don't take action in the future, we will not have the qualified, competent people to take care of our health. And not everybody can leave the Gambia. So I think the National Assembly Health Select Committee should look into that. It's across the board. Not all nurses are leaving at a larger number, but other professionals are also leaving. I'm aware of that. I think my co-president will talk about that because it's across the board. And then also funding activities. For us as the Nurses Association, primarily our fundings are from our meager contributions we are making, $100 and $50. And then we are funding capacity building, we are funding, trying to build our secretariat, we are trying to do a lot of things. If fundings are available, opportunities are available, obviously that will help. The working conditions of nurses and health professionals in this country is important. I can give an example of myself. Being trained from community health nurse CHN to PhD level with reproductive health, that is not easy. And it took me almost 25 years. If I had not sacrificed, I would have left the country well before that. And then upon my training completion, I was giving an allowance of $1,000 on top of my salary, up to 2023, when I was promoted as acting principal lecturer up to today. That is June 2023 up to today. Is that motivating? We know as a PhD holder, obviously, you can have a lot of opportunities, either here or outside. As a health practitioner, right now when we went to Canada, we were given a 4-year visa, multiple entry. It will expire February 2028. What that doesn't mean they have opened their doors to us. So if we are not patriotic, we would have just come back and then do our transactions and then we go back and then start working and then we will earning a lot of money. But at the end of the day, I will obviously benefit my family and my immediate family. But when I came back at the higher school, I'm lecturing more than 400 people. I've worked with somebody and established an SEN school, which we have recruited 150 people. Obviously, that services, if I had stayed in Canada, make more money, Gambia will lose that, the service I am offering now. So I am seeing my country first before any other personal gain. And I think what health professionals are seeing in that needs to be acknowledged and then motivated to do more. I think I will stop here, and then if any of my colleagues have anything to add, then they can. Thank you, sir.
Thank you. Yes, you have the floor.
If I may continue from where he stopped on the motivation. Yes, some time ago, IBF was complementing government effort very well, where staff in the health center has their own mandate to run the affair for some petty things that transpire in the facility. But as for last year, middle, we stopped receiving the subsidies that was coming, and that is really disturbing the work. Like last week, they came for assessment, and you could see that a lot of facility was dropping because why? The motivation is not there again. When it was coming, staff was working very hard. They was already, when you talk to them, you will see them, they are ready to work. But now when you want to talk to them, they will say, we are just working and we are not seeing the motivation. And honestly, it's really killing the health sector. Because as you see about the nurses going out, a lot of people are finding their way out because of what they are receiving. It is not enough. And most of the time we work tirelessly. Some of us go, from there you have to go for part-time again just to make sure ends meet. So if the select committee can look into it, it will be okay with the coming of the health insurance. I think it will also help to boost the motivation and encourage nurses to work more into the government sector, because not everybody have that money to go to private. And a lot of people, sometimes you go to private, at the end of the day, the same private you go to will now transfer you to public facility. They will take all the money they want to take, but when it comes to push, you will end up into the government sector. So I think the health selected committee have to look into it and see how best they can retain the health workers who are in the government facility, because it is a great sacrifice we are making, and we are ready to do it because we love our country and we really want to work. But if the motivation is not there, it's difficult.
Yeah, good morning once again. Omar Balde. So I would like to add into where David Day has stopped. On my part, I would want to discuss the educational aspect. We understand health is dynamic. Doctor has reached a level that many of us are aspiring to. That is a PhD level. But you cannot reach a PhD level if you are struggling to make ends meet. So that is why the attrition rate is very high, and it's going to be very high. You know, every other day you hear, like he said, a nurse is traveling, and then nurses are just going to do it. So some of us here are motivated to go, but then you also think of the responsibilities that, you know, are there. Because you would understand, sometimes I work as the officer in charge at Sanyang Health Center. Yeah? It's major by nomenclature, but service-wise, it's just a minor. So you would understand the conditions at work are really not appealing, especially now that the RPF is gone, the insurance is yet to come. So I'm talking about the studies aspect. There are a lot of health workers that want to study, but then it's very difficult trying to afford university tuition fees. Yeah. And then you would understand you want to study, then you have to be deferring your courses, just to make sure that you get that time to study. And then if you go to apply to either higher education or some other places, you'll be rebuffed because, of a lot of things. And then to the extent that you have the capacity to pay for yourself, you would be removed from the nominal role, because you have not been given clearance by the Ministry of Higher Education, or we are not giving scholarship to study. And then this in turn haunts you, because if you are taking up the nominal role for the payment, your salaries, where are you gonna get the money to study? So most of us are left to fend, off scraps. And then the other part is, I believe healthcare workers are also struggling with accommodation. Some of us are still living in our parents' houses. Some of us are renting heftily. We understand that transport is just one aspect that takes chunk of your salaries, talk less of trying to pay rent. So I don't know how best the health committee would look at this and then see to bring that. There are a lot of estates here. If we can have lifetime packages that we can have housing, this could be paid in insurance. Some of us still have 30 years to serve. We could make a decision, have our whatsoever insurance, and then we could pay small, maybe by the next 20 years. If I'm paying $1,000, I might have 200,000 to have where I live. So these are all things that I believe the Parliament and the Select Committee could help us, because health workers are struggling, and then it's not just nurses but also public health officers, because we work under the same roof. And then in most of the places we commuting due to the fact that we don't even have residences in our facilities. They're either too dilapidated or we don't even have houses there to accommodate you. So this is why sometimes it's very difficult. You go to work and then working conditions are really not standard. So I believe a lot can be done. We are ready to give a lot, but then the ability to give needs to come with the, the will to give needs to come with the services available. So I think my colleagues would also take it up on it. Thank you.
Thank you very much.
Yeah, thank you. Yes.
I just want to add my voice. I'm still going to be on nursing education because it's one of the foundations as far as the development of nursing is concerned. And then under the Ministry of Health, we have the Gambia Corrector is training nurses, but it's under education. Under the ministry, we have 2 schools, that is the school for enrolled nurses and then the enrolled community health nurses. But unfortunately, the staff in there are very demotivated when it comes to some of the packages that the other nurses in fact have in the other sectors. They don't have. I think sometimes last year they have lost nearly, I think, for most of the senior lecturers, up to about 7 to 8 people from the school who have experience, who have the history about the school, and all moved to the other sectors of the health because of the thinking of they are giving them teaching allowance of $500. Teaching allowance of $500. And then now you increase other areas, their allowances, and those people are demotivated. They all left. So it will come a time if people don't intervene, maybe the schools will close. It will be a very big loss to the country because, like the president said, if Europe and other parts of the world are draining from us, I know you don't want to give the figure, but if you give the figure in 2023 alone, it's nearly 100 nurses that left for UK, America, and Canada. And it's still ongoing. Because they are demanding. The number they are demanding, they cannot have it. It's not possible. So I think those areas should be looked at. And then also, those lecturers should be motivated in terms of scholarship packages. They should have easy access to develop themselves and then be willing to stay and give back to the country by developing and grooming the young ones. So I think that's something that we need to look at in their area as far as the educational aspect is concerned in nursing and its related issues. That's going to be my contribution. Because other areas I want to talk about.
Thank you very much.
It affects me more than anybody. My district hospital. Yes, sir. I don't have any everything there. Whereby I couldn't do CS for women. And I was buying everything from the RPF. And then to cross is a nightmare for us. No ferry. So I think the RPF for the NHI one should come in and give me the medication for my women not to cross. I don't like seeing women crossing to Banjul when I can offer the services. Thank you.
Thank you. I think some of those ones will probably the most taker. So just to connect to where I start, Honorable Kamara, I think that issue is about, generally it was about an uneven distribution of the allowances because sometime in 2021, new allowances were created for the nurses. But unfortunately, for some reasons, the distribution was not even, meaning to say it was not a blanket approach. Like it only affected those at clinical level. So the nurses who are nurse tutors in the schools were not affected. Also the nurses who are at central level were also not affected in that increment. At our level also we are looking at it, but we seem to be challenged for the fact that what they are trying to say is the allowance have already been appropriated and has been paid. But we also have a chunk of the nurses who have not been receiving. And we feel it is not also fair because they are equally nurses and they are under the association, they are also contributing. For me, always, all the time they will be confronting me saying for them also, why are they not benefiting? And we feel it is their right also for them to benefit since it was created for everybody. They are also public servants. Let's say a case in point, even me, I used to benefit when I was at hospital level. But now it has been stripped off because I'm also now at central level. So I always tell them, you see, even me, I'm a victim myself. But maybe we'll look at that and probably if it reaches to a level, you can also, bless us with it and do what is necessary to ensure that it is approved. The other one is also about our Nurse and Midwife Council subvention. Although it's an institution, probably they should come here and make the noise they are supposed to do or blow their own trumpet. But however, as members or as beneficiaries of that service, we are feeling the brunt of it, the consequences, because recently there has been a hike in the tariff, that's the lancing renewal and all other lancing services. And for them, they said that increment was done on the premise that they are not receiving subvention from the government. So that means they do not have the financial muscle to implement their activities. So what the only thing they can do is to increase their tariffs. Let's say, for instance, a lancing that used to be renewed for $1,500 was increased to $5,000. That was an increment of more than 200%. And all of us here, you know that is naturally it's not fair even before the eyes of God. You cannot increase something to that percentage, more than 200%. So we were able to battle with them to a certain point. The minister even have to call us. I was there, they were also there, so the minister called because I wrote a letter to the chairman and I told him that it is a concern and that the situation is very precarious if it is not resolved professionally or maturely to reverse the tariff. We wouldn't have an option but to allow the majority to decide on their own. And whatever decision they take, we have no choice than to rally behind them. So I think, and the minister was copied with the Director of Health Service, so when he saw that he has to call me and them, so we went back again, said extraordinary council meeting. I wrote a petition, 2/3 signed, I was lucky, they signed it, and we had an extraordinary council meeting. But what we are also trying to say here is, you can also support by any means necessary to ensure that at least the council has received their subvention. So when that happens, at least they wouldn't be increasing the tariff, which we will be paying ourselves. Because now if they don't receive subvention, they do not have any source of funding than from this lancing renewal. So the only thing they can do is to increase the lancing renewal fee, and we are the one paying that. Imagine now, even if you're paying $5,000 is one time, because if you don't pay, that means you are practicing illegal. It's just like the driver on the traffic without a lancing. The police could impound your vehicle, and they can also equally drive you to court. So some of those things are very implicating, and none of us wouldn't want to fall into such traps. So we will also equally call on you, because we are concerned. Most of the time, if this thing happens, the members will come to us, express their dissatisfaction and dismay. And for the past 2 weeks, this has been the outcry of nurses in the whole country and even abroad, because they realized that the increment was too much, and it is something that is mandatory. Once it is done, the increment is done, you must have to pay. Luckily, it has been reduced, tentatively, to some point, yeah. But we want you to support in trying to subvention.
It's reduced to what point?
One is only one of the services that has been reduced. That is the renewal. But because you have to do exam, that has been added double, 100%. Verification has been triple, or let me say fourfold, more than 200%. So for the, and in fact for the renewal it's even worse for the Gambians. Yeah? You also have the school accreditation, also more than 200% increase. So see, for the lancing renewal, we have to battle to a point. It was only reduced to more than half. Like it was 1,500, they increased it to 5,000. So when we did that battle back and forth, we went to the minister, came back, then I wrote a petition, it was signed, an extraordinary council meeting was summoned. So we now, luckily for our team, we did the voting just like parliament proceedings. So majority of us voted that now it can be increased to 2,000. So in that we succeeded, but for all the other services we could not succeed for them to be reduced. And all what they will be saying is they do not receive subvention. And ordinarily, if they do not receive subvention, there's two things. They will either be there without doing their job, or they close the council. And we will also want to get to that level where the council will be closed, because that means it's going to put our professionalism at stake in the international community. Because wherever we go as a nurse, you must have to present your lancing. So that is going to prove that you are a professional who is lancing. And for our council, I'm not trying to boost, but up to this material time, the recognition is very big and is well recognized as a robust council in this sub-region. And that is why you will see people coming from other West African countries just to get our lancing. Because the council has been well recognized in the work they do. So we will not also want to put that credibility at stake. Because once they are also not motivated, they don't have fun to run their activities and do whatsoever is needed. They're going to go home or they will look for other options. Thank you.
Thank you very much. I think that does it from your side, unless honorable members come in and then there are questions or comments that they need clarification on. So, on behalf of my colleagues, I want to thank you for the deliberations. Unfortunately for you, we don't clap, so don't expect us to clap for you. So, honorable members, that does it that we had from the Association of Nurses and Midwives. We have from their president and some of the executives. So now the floor is open to any honorable member, any questions or comment. So, yeah, the secretary is also suggesting we allow the other, also like the public. Yes, they are if that is okay, please, in the meantime, take note. Don't forget the questions and comments for them. Yeah. So thank you very much. So now we shift on honorable members. If I will now hand over the floor to the president of the Association of Public and Environmental Health Officers, for them also to run us down on some of the activities that they do, and then of course possible challenges and what for us. I know some of them might be similar because many times you notice you had them quote and say it's not only us but all the other cases. So if the floor is up, Mr. Fofana.
Yes. So, Honorable Chair, honorable members, colleagues, good morning. My name is Noah Fofana, public health by background, field epidemiology by specialization. I currently work for the Epidemiology and Disease Control Program of the Ministry of Health as a field epidemiologist. Our association, now called APEHOC, was established in 1971. Of course, with the sole aim to complement the effort of the government in trying to make sure the health of the populace is being safeguarded to the highest level possible. It was initially referred to as the Association of Public Health Officers, but later on the name has to change because of some registration issues, and it was later renamed as Association of Public and Environmental Health Officers of the Gambia. And we also have regional associations because in health we have 7 health regions. So for us, we don't only have a central association, but we have sub-associations in all these regions who are, of course, answerable to the main national association. So our executive positions, of course, like many other associations, are based on a voluntary basis. So these are some of our objectives. First, the first one is to protect, of course, and promote the health of the public, as well as those people who are serving within the public health space. And secondly, to facilitate effective communication with appropriate authorities, because we know not every Tom, Dick and Harry can or should be allowed, to say anything or to go anywhere to talk about anything. So issues affecting public health officers or issues that are affecting the health of the populace, we sometimes intervene to make sure the right authorities that need to hear what is happening, what exactly is transpiring. We also look forward to promote capacity building among our members. I know in our achievements, we will dwell more on as far as our achievements are concerned when it comes to capacity building. Just like one of our colleagues said, the world is dynamic, more so health. Things are changing every day. People need to be aligned with aligned with the status quo. So for that being the case, we deem it fitting to see how best we can capacitize our members. And also to advocate for scholarships for our members, both within and outside the country, to increase their knowledge and skills to better serve the country or anywhere they will find themselves. We also try to collaborate because we know as an association, we cannot tackle everything. No human being is an island. No association is an island. No person can do it alone. So we try to foster that collaboration with our sister associations across the country. Most of the nurses, the pharmacists, the lab assistants and there, to make sure we bring our expertise together and serve the country to the best interest of the country. And one of the objectives too is to always engage relevant stakeholders, especially in the area of public health policy development, because we know, to have better implementation, especially in the area of health, they need to be backed with ideal policies that will speak or that will commensurate with existing problems. So for that being the case, one of the things that we do is to engage stakeholders whenever the need arises. So moving on to some of the achievements that we register as an executive. So this particular executive came into office in January 2022. So for us, we serve 2 years, we leave and others come. And hopefully very soon we'll have a Congress, another executive will come. So one of the things that we did is to support public health professionals during the COVID-19 outbreak, because we know by then the government was overstretched when it comes to expenditure. So we provide some support to some of the health facilities within the country. Some of our offices with gloves, masks, and some other items that we may need to adequately respond during the outbreak. So we also rekindle our membership status with the Continental Association that oversees the activities of public health associations within Africa, which is African Federation of Public Health Associations. That was done when this particular executive came into office, and luckily, during one of the conferences I attended in Zambia a few months back, although I was sponsored by Africa CDC to attend, that particular federation held their congress. So I was fortunate to be elected as a board member of the African Federation of Public Health Associations. To be more specific, that will take charge of capacity building of public health professionals in the continent. And when we came into power, the executive or our association was not a full member of the World Federation of Public Health Associations, but we fought hard to make sure our membership will increase to full membership. Already we've submitted the right documents to the Federation, and hopefully during their next Congress in May, our status will be discussed, and hopefully we hope that our membership will be increased to full-time membership. So every two years, we conduct what we refer to as the Public Health Awareness Week. So this is a whole week jam-packed with activities or interventions which we believe will help or better the health status of the population. So one of the things that our members conducted during this was the career counseling and guidance, because we know public health nowadays is a hot cake, across the world. So in order to tap the creams of the society, we visited various schools to talk to them about the career prospects in the field of public health, to entice them into public health. This we believe is very important, more so looking at the current state of public health officers in the country. And one of the things we also do during this week is community sensitization, be it at the community level or at the schools, on key public health issues that are of course trending. And one very important thing which we do during this public health awareness week is to go into communities to conduct what we refer to as active surveillance. So in active surveillance, we look for certain kinds of diseases, which we refer to as epidemic-prone diseases. meaning diseases that can easily, explode and have a lot of cases and fatalities. So we went into communities, although people are doing it routinely, but this one, it was done across the country on the same day. So we also organized what was called the public health fair, the youth monument, where we showcase many things that are conducted by public health officers during public health fair. And we also try to include blood donation. We encourage a lot of our members on that particular day to donate blood, which was circulated, across the country. And during the week 2, we have a seminar, during which we selected a very important topic, a very important public health topic that was discussed. And to wrap up everything, there was a sports day, and during the sports day, we invited a lot of cadres, to come and join us to, do some form of exercise. So, another achievement is support for members on international training, local and overseas medical treatment, financial aid. So when it comes to training, as of now, we facilitated a scholarship for one of our female members, and that female is now studying in India. She is doing her master's in public health. That was facilitated by the association. We also supported a member to undergo a treatment in India. He was involved in an accident while on official mission, but the support was not enough to adequately, sponsor his treatment. So we supported in some way for his treatment in India. And not long ago, too, we supported the School of Public Health, because that is where all of us were baked. We supported their community outreach, and we are on the verge of giving them some water dispensers. That money has already been withdrawn. Another achievement is what we refer to as the back to school package for our deceased colleagues, like our colleagues who passed on or who died. Last year, September, we gave cash support to more than 40 children whose parents, either their mom or dad, was at one time a public health professional in the country, but they are no more. So some amount of money was given to them to support their school. And of course, one of the things we also did was to conduct a countrywide tour to have a first-hand knowledge as to the issues affecting public health officers in the country. So the last part of my talk will be on the constraints, but like the chair actually highlighted, most of our constraints are more or less the same with that of the nurses. Like they put it, we usually serve under the same roof. Sometimes we even share a bed, in our various health facilities. But of course, we also have some constraints which are peculiar to us public health officers, we believe. So one of the issues of local constraints we are battling with at the moment is a lack of office space. At the moment, the office of the association is usually housed by wherever the president is working at. So that is one thing that we are really struggling. So sometimes we have meetings, but to have a space to even discuss becomes a challenge. So just like our brothers put it, if the National Assembly can help these associations, to be allocated land, to see how we can develop, to have our own office space and even conference, spaces here and there, which can be used to generate money for the association. And one of, maybe I will actually last with this one. So inadequate accommodation, like our brothers put it, some are travel, some have to travel every day to their workplaces because they don't have adequate accommodation where they are working with. And one very important challenge too, public health officers usually they are not stationed at the health facility to do work. Every day they have to be going into the field, to carry out their functions. And to do that, you need mobility. And many of our members, in fact, many of the public health offices in the country don't have a functional motorbike, that they can use to do their functions in the community. So it will be of great importance if the select committee can actually intervene in that aspect. And one constraint too which members usually face is the delay in promotions. The delay in promotions, so that people will serve for many years before they're actually promoted to another level, even though they actually meet all the criteria to be promoted. So to fast track that, I think the select committee can help too. And one thing we learned not long ago that the PMO has actually started is to prevent people from sponsoring themselves if they want to further their education, citing the fact that they do not have scholarship. Even though individuals will want to pay for themselves to further their educations, if they go to seek for study leave, they will not be given study leave. Instead they will tell them, until you have a scholarship, you will not be given scholarship. I cannot figure out, their justification for that. Somebody who is willing to sponsor him or herself, why do you want to deter him, from furthering his studies? So I think the Senate committee can also help in that. So maybe this will be my last. My other colleagues will come in after I'm done. That has to do with the issue of unpaid allowances to the public health cadre. I think we all have fresh memories as to what transpired. Is it last year? Yes, last year, 2023, when public health officers decided to go and sit down strike, because to me, I think that was one of the greatest injustice. I know that have befallen our this beloved cadre, selecting 1 or 2 cadres from the whole Ministry of Health, allocating allowance package for only that cohort, and you forget about the remaining cohorts. Still now, I still have sleepless nights, because of that. We've fought tooth and nail. We've used diplomacy, it failed. We've used the other way around, it failed. But that memory is still fresh in our mind. So I would really want to plead to the National Assembly to please take that up, because we believe we are seriously being maltreated. But you will learn up to master's level, or you will educate yourself up to master's level, and still now somebody with a diploma, earning more than you. That we believe is a great injustice that is currently happening, and it really needs to be looked at. Just like they say now, even some of the nurses are not even benefiting from that. So I want to stop here to allow my colleagues to also come in, to share their own views. Thank you.
Okay. Thank you very much. If you have anything to add up, you can go ahead before we move to other members. Thank you.
Thank you, Honorable. I am Mohamed Keita, the Assistant Social Secretary. I would like to contribute for what my colleagues, Mr. Condescender, in the issue of education. This is not only something that is a big priority, but it is something that should be looked at immediately. Because we have seen instances whereby nurses and public officers and employed health workers will go to seek scholarship from the Ministry of Higher Education. They will be denied, and people in the private sector will be given. And at the end of the day, these people will come back to work for the government, and the other people will go back to the private sector. And if we say this is taxpayers' money, there is nobody who's paying tax more than healthcare workers in the country. Right? If they go to seek scholarship that is given from taxpayers' money, I think they should be given priority. Because if someone endeavors to go to the up countries and serve there for 2, 3, 5 years, now has the opportunity to be enrolled in the University of the Gambia, only to come back and be told, we will not give you scholarship. You have the academic requirements, you are already in the university. In fact, you endeavor to pay few semesters for yourself. I think they should be given priority. Because, not to say, it happens to me myself. I've served in the up countries, I came back here. One of my colleagues who even refused to work for the Ministry of Health, we went to apply scholarship at the higher education. I was denied and he was given. Now he completed his studies, he's in the private sector, I'm still in the government sector, receiving less pay than him, and he was benefited more from my taxpayers' money than I did. Which I feel is a big injustice that this select committee could pick up for the entire healthcare workers. Because it happened to my colleague nurses. Some I even left them in URL because of that. They came and applied for nursing programs, they paid for themselves, and PMO had to cut their salary. They had to go back. And people are here who refuse to work for the government, they sit in the combos here with their families, enjoy with their families, having better pay in the private sector, go and apply for scholarship, and higher education and PMO is giving them scholarship on top of government employees. This is something I think you could actually take up. The next thing I want to discuss is the issue of our council. Like Samba Boy said, councils are established entities, and I think they are very important. I mean, for the fact that they've worked hard to earn their mark in the international world, that should not be something that should be looked at lightly. There are subventions from the ministry, something that should be paid. Because if it is paid, it will create a better working environment for even healthcare workers in general. But right now, the problem our council is facing is the council is established, but our council doesn't have a space, even a space to work from. And they have been given, sorry to say this, it's a cubicle from the at Kotu. It's not very funny because looking at a council established by an act of National Assembly, it's not given its allocation. It doesn't even have a working space. They don't even have a place to park their vehicles, and they're actually given a cubicle to work from, which I feel is a big injustice because if these councils are not regulated, the people they are trying to regulate will not be regulated themselves. Thank you.
Thank you very much, Mohammed. And thank you, Heki. Honorable members, I would just like to put a word or two on top of what my president said. He did mention something very, very important, and that is the issue of policies. You know, in whatever we do, especially with regards to public health interventions, policies are the most important thing. And lately, if you can realize, one of the biggest problems we are facing in this country is the issue of food, the issue of water. Every day, if you're on the internet, if you're on any social media, you hear people complaining day in, day out, you have seen expired food. The water they are giving us is not standard. And things like this are the basic things when it comes to health. If your food and your water is not regulated, forget about any other intervention you want to do in health. It will not be important anymore. And you realize the food quality, FSQA, the Food Safety and Quality Authority, is responsible for controlling the quality of food across the country. But before this, the modus operandi was public health officers across the country, from Katong to Koina, we are responsible to be doing inspections with regards to food premises and food in general. But when the FSQA came into play, these functions were taken from these public health officers. And now the FSQA is responsible to make sure that these foods are being inspected across the country. But the funny thing is, they don't even have that capacity, because this is the fact. They don't have the capacity to be able to routinely inspect all food premises from Katong to Koina, because even in Combo, it's a problem for you to see them everywhere. Talk less of going from Combo down to Basia. And this has been a very big problem and a very big gap towards the safety of water and food across the country. And I think this is something that we really need to put into consideration, because food and water is something that we cannot play with. And it's something that's a daily need for everybody. So if we do not have a body that has the capacity to be able to look at the quality of these things that we are consuming, what kind of health do we want for our people? So I think since it's an established body already, what the select committee can also help us with is there a possibility of at least having an MOU, a comprehensive MOU between the ministry and FSQA to say that public health officers across the country were doing this job and they were doing it to the best of their ability. And we all know most of these problems we are facing right now, we are not being faced at that time because we had the capacity. Our members are everywhere across the country. Can we have a comprehensive MOU that will look at both parties to say, okay, you have the right, the mandate to be able to go and do inspections in food production areas or in premises where food is being produced or water is being produced. And that way we will be able to at least up their capacity to be able to know the quality of food and water that we are facing. Because I believe this is really a thing that we are facing, and day in, day out you'll be seeing people tagging FSQA this, FSQA, you have seen it there. What are we doing about that? And this is a basic necessity for us. And I think you, as the representative of the people, really have have that responsibility. Because us, we can serve the people, for sure, but there is a certain level that we can stop at. Policy is not our work. That is your work. And I think this is something you really need to intervene in, and something that needs to be really urgent on your table. Yeah. Thank you very much.
Yeah. Thank you, honorable members, and thank you, my colleagues, for bringing out the core issues that we face in our work. And we are here representing our members to bring out the plights for the members of the parliament to look into and have a way forward around it, and also be informed about our core functions. One of the core functions that we as executive of these various associations is to ensure ethic of conduct and dress code within our workspace. During our tour to meet our members and know some of their constraints, we have spotted out some of our members were not properly uniformed, or when we try to address the issue at hand, they were not even being supplied uniform to begin with, or the type of uniform that they are being supplied are not the desired design or so. So we believe identification of staff and proper dress code is a civil service code of conduct. You should be able to know a nurse attendant, public officer, a lab scientist. Distinguishing is very, very important. So we feel and believe that the Health Select Committee can also look into this, because the members of public health officers are battling with this supply of uniform. They are facing that. So without repeating what is already been said, because if we want to talk further, we will begin to repeat what is already being spoken by our first speakers. Most of the things I have highlighted here were already trusted. You can see me marking them. So thank you.
Okay, thank you very much, Madam Treasurer. Good morning, or I don't know if it's afternoon. Okay, and my fellow colleagues, I am the Assistant Secretary General, Vivian. Just to add on to what my boss said, the policies as well, in the aspect of the Public Health Act. I think you people can really be of help to work hand in glove with the ministry, or to see how best this act is revised. Because the one we have in is the 1990, and from it we have other acts that we are derived from it or extracted, like the Birth Registration Act. And as we all know, there is a new registration system, the electronic one, that is the CRVS system. That's a civil registration on vital statistics. And it is a right for everybody born, or every child born, to get his or her birth certificate. For that birth to be registered and certified, even within the first day that child was born. But we see many people will be considered stateless because, let's say, this 1990 Act requirements, the requirements to get a birth certificate does not work in our current day. The fee is very minimal, and that fee is what goes to government coffers and what can be used also for the development of the country. But it's not been revised since 1990, and the fee is just $12 is 50 bututs. It's just like free. So this needs to be revised, because we are in a developing world. We are in a technology era, and this registration of birth, or whatever civil registration, it's like a prerequisite. It's like a right for every individual. So for some people to be refugees in your own country or stateless in your own country, it's not good. It's very bad, just because the right policies or the right act or the right regulations are not in place, or even if they are, they have not been passed or have not been forwarded to the next level where it can be moved forward. I don't know what is the word you use, the approval and the motion to take action. So I believe if I believe you people can also help in that area, because policy making and regulations and acts are all part of what you do. So if that is done, at least it will help so many people will have their legal identity. So many people also will be backed by the law, because some of these things that are captured in this 1990 Act are old. They are very old and outdated, and it cannot even apply in these days, our current generation. So I think that is very important. And then I'll rest my case here. Anyone else? Thank you.
Thank you. Thank you very much. Any order from you? Yeah, let me not have time because my first 30 is pretty good. So now, let's make the best use of the 30 minutes that we are left with, because I know other members will come up with many questions at PM and then maybe comments, because I have not been here when the public officers started, but I know they have also done justice from what we expected from them. Because this is a familiarization meeting, and of course, it's an opportunity for the two associations to share with us, like I said initially, what you do and some of the challenges we are facing. So, thank you very much, honorable members. You have from both sides. So now, the floor is open. If you have any questions, comments, rules, way forward, please come on. Okay, if you see so, thank you. The floor is yours.
All right, thank you so much.
Just address your questions accordingly.
Yeah, I may have questions also or comment.
Okay.
Thank you. Like I said before, we have two associations here, the nurses and the public health officers. Thank you for the presentation. I think you highlighted so many things that are concerns for your various associations. One of the key things from the presentation I highlighted is the lack of interface between the select committee and most of the associations. To a greater extent, let me say at least 2 or 3 times in the year, because sometimes we don't have the interface except for once, let's say in a year, which is not, for me, is not sufficient. All the information that you have, all the concerns that you have as an association, because if you sit here as representatives of the people, we would not know most of this, the challenges that we are facing if we don't have that interface. So I don't know chairperson, but then our interface with the association should not only be at the National Assembly. Sometimes it can also be other places where you have challenges taking us through, so that we can work with you, because it will be difficult for us to address all the problems that we are facing when we are working with you. The only time we have is when we have challenges, and then, kind of a presentation is done. And then from this presentation, we'll have 1 or 2 things, and then we move. By the time we call the minister to come, he will give us another information about, inform what you said. So we are sometimes challenged as well to be able to address those problems. So that is one of the comments I wanted to make. Maybe we can move from this level. Yeah, we can try to, bridge it up more and be close to each other, both the nurses and then the public officials, so that we can have engagement as quickly as possible. At least one after the other, we can address problems. That will help us too. Otherwise, we'll have 10 problems, you can address them at the same time, and then they will come again. So that is also important. So the next one I wanted to say is probably with the issue of motivation. I had the president talk about motivation. I know a lot of health workers are currently leaving the country, going to Canada, US, and other places. It's important for us to know as well, because for us, as representatives, when they ask us motivation in the system, we say, oh, because we are not giving them much money. And that may not be the only motivation. But it's also important for all of you to tell us what are these motivations that you think are key in the sector that will reduce the rate of attrition in the system. Because when you call the minister, oh no, your members are not motivated, the nurses are not motivated. Oh no, because they need more money, they want us to give them more salary. So you see, yeah. So it's important for you to also highlight some of these things, so that to be specific. When we are dealing with the minister and the permanent and anybody, we are specific on, what motivations we're talking about, so that, they can easily address those ones. And then, Chair, that's my point.
Yes, thank you very much. And then I think that will just bring me to this point. That was a very good one. With regards to our today's engagement, we will want from you, both sides, to share with us your presentations, highlighting all these things that you've highlighted here. That will help us, because it's one thing to talk, because our secretaries here are taking note, but it will also help if we receive the officials' communication from you, highlighting all these things that you have, because it's very important. Because at one time we will incorporate all this, and then we'll have the opportunity to present it to the plenary, whereas every member will have the opportunity, and we debate over it, offer into solutions. But of course, within our internal oversights also, we can take up some of the issues with the ministry and some other stakeholders, because like you mentioned, the Ministry of Land, on your land issue and so on. So thank you very much. I think that was more or less a comment. We appreciate the Honorable Baji.
Yeah, before I comment, I just want to pose some questions. Good afternoon. By the way, I am Honorable Musa Baji, member for Kalinding Kunyang constituency, also member of the committee. I wasn't here when introduction was being done. Let me start by asking I would like to know, like, board associations, all members, all nurses automatically members of your association, or by virtue of subscription or otherwise? Once somebody graduates, he becomes an automatic member, or there are criteria or something. And then if that is the case, the population size of your membership, both of you, I would like to know for those four. Yes, somebody mentioned about graduate, somebody can be a graduate, whilst a diploma holder is paid more than you. I want to understand this. Graduate in the field of your profession, if you can address, I want to understand that and how that is possible. Yes. The council, the Nurses and Midwives Council, right?
Yes.
It's an act of parliament, right?
Yes. Yes.
So it means, like you said, when I came, you were on that presentation, and I kind of don't understand why they should be increasing the licenses to finance their operations. This is a government-established council that is supposed to be solvent. What they should do is they should pursue their subvention at all costs. Subscription fees are not meant to finance their operations, but to supplement. And now that you want to use that license to run with the entire operations, that is contradictory. And I think, though it's resolved now, it's reduced.
It's not resolved.
You said it's reduced to 2,000.
No, that's some areas.
Honorable.
Actually, what
Order, please, order.
Yes, because what I can understand, just like the hospitals that are being subvented, and they now say government is not subventing fully, they are going to do some charges on medicine, charges on, it's ironical.
Exactly.
It doesn't make sense.
No, at all.
At all, because the purpose of creating this council is to have a separate body away from the government to look at your affairs and to have control measures. So they are an ad hoc entity for the government.
Yes.
So you are beneficiaries.
Yes.
We are not the beneficiaries.
No, right, by virtue of its existence,
Yeah.
you are supposed to be beneficiaries.
Yes.
To enjoy services, and also the police your behavior in the profession. So it doesn't make sense. I think this is something the committee can do. I know. For me, I'm not here when you mention all those things. When I came, I found you only on these lenses. I missed out most of the things. But it's ironical that you people have to bear the brunt of all the expenditure they are doing. The scholarship, somebody mentioned, is I think, yes, it's ministry's responsibility. You people are on the Ministry of Health, right? Now, when you apply in higher education is offering scholarships, giving every Gambian equal access to that form. So I don't know whether that is the procedure. What I think is personnel of Ministry of Health should be able to access that fund at higher education, but through Ministry of Health. If you want to be privatized, because you need to be privatized, but it's to be supposed to be, if you want higher education to take you seriously, I think the ministry, it should go through the ministry. Otherwise, they give every Gambian equal opportunity. So if that is not the case, you can just come up and elucidate on that, because I think that is supposed to be the case. You apply under your profession, but through the ministry, or there must be a quota from the higher education to say, we have to give it to Ministry of Health to assist, to capacitize the people that are providing health services in our country. So there must be something. I'm talking longer. So
do you have a further question?
Yeah, one
you
on policy. No, these ones are comment. The higher education ones are comment. But if he can elaborate on that, and if there is need be, we can even make further engagements with higher education. Yeah. But I think it's important that But and one crucial thing we encountered during our tour from the ministry, and then even one time the permanent secretary raised here that personnel that go seek university admission go and start courses without even consulting the ministry. This is a challenge for them. And then sometimes they have these arrangements at their regional level where they absent their regional supervisors, allow them to go and sit for and do their classes where they don't have any official letter. And then there is a capacity gap at the level of the regions or at the level of the facilities you are serving. This is something the ministry raised here, and then we encountered it on our tour. You understand? So this is something, yes. The issue of somebody raised a policy, you raise a very important thing. And I think if an entity that is established by a government has to operate across the country, if they don't have capacity and personnel to do that, then there is no way they can effectively conduct. So, and you people are trained, even before they were established, you are people who were doing them. There must be something we should synchronize here, so that I agree with you.
Most of them are problem officers there.
Yes, so
what is that? I missed that.
They are not everywhere. And then,
I just want us to let it go.
Yeah, we have to engage. I'm just reinforcing.
They are part of our stakeholders. Are you okay now?
Yeah, I'm fine.
Okay. So now I think before we move on, let's allow them to also maybe say one or two things on some of the issues that you highlighted. And any other member. Yes. Yes, the floor is yours, but please, we are running out of time. He asked and make comments on different issues. Membership,
yes.
Membership, and of course, graduate diploma, allowance, is it salaries or allowances? Whereas a graduate diploma is something like that. And of course, the nurses council tariffs,
yes,
and also the issue of scholarship.
Thank you very much, honorable members. For the association, it's a voluntary membership-based association. However, we encourage every nurse working in the Gambia to be a member because there are numerous benefits. And we sensitize newly graduated members from when they start. When they graduate, we sensitize them. The membership as of now, what we have in our register is about 2,500, but the active would be around 2,000 plus. But again, what we report to ICN and ICM is different because the more membership you report, the more charges you are to pay international dues. And last year we paid over almost $80,000. So that is also constraining us. When we come to the nurses council charges, right now the council is depending 100% on levies for licensing and related licensing services. As the President and the Secretary General are automatic members of the Council, we are privileged to be there when they make any decision, and one of our Assistant Secretary General. Just a brief summary, in 1991 to 4, it was $240 for first level and $120 too for second level. And then other ECOWAS national was $300 and non-ECOWAS national were $1,000. To currently now, let's say 2020 to 2023, it was increased to 1,500 for first level and second level 1,000, ECOWAS 2,000 and non-ECOWAS 3,000. 2024, it was increased to $5,000 from 1,500 to 5,000, and then for the second level, it was increased to 3,000, as well as the ECOWAS to 8,000, and then for first level and 6,000 to second level, and non-ECOWAS 12,000 for first level, and then 8,000 for second level. And then when we wrote that petition and called for an extraordinary meeting, we discussed and then we reached a conclusion in which it was revised again to $2,000 from 5,000 to 2,000. That is the first level for 2 years, for a 2-year period. And then the second level is 1,500 for a 2-year period. But the ECOWAS remains the same, it's 8,000 for a 2-year period, and then the second level is 6,000, whilst for non-ECOWAS it is 12,000, and then for second level it is 8,000. Again, other charges. If you want council to verify your status registration, either is from, if it is outside, if you are in the country and an institution requests council to verify your status, they are charging $5,000. And if you are outside, if the institution is outside the country, and then the person also is outside the country, they are charging $10,000, which used to be around $1,000, $1,500. So now it's $10,000. And then to establish a training institution, private, the second level was about $35,000. Now it has been increased to about $100,000, but a period of 2 years. The first level is increased from $70,000 to $150,000 for 3 years. And then the nurse attendant, which is not under the mandate of the Nurses and Midwife Council, but we're working on how to regulate them, to have supporting document to regulate them is 50,000 for every year. And basically that is, and that is the summary. Those who are privileged to see the allocation, appropriation budget, other councils up to the laboratory councils have been appropriated with some, with certain amounts. But the Nurses and Midwife Council is not mentioned in that appropriation. It is only health allied professional councils that are being allocated about 1 million plus. And then the registrar said he has communicated with the chairman of the Health Select Committee, and it was clarified that Allied Health Council is referring to the Nurses and Midwife Council. By virtue of numbers, the Nurses and Midwife Council is the biggest council. Last year, the council hosted the West African Postgraduate College of Nursing and Midwives, which is a biannual general meeting, which is hosted by Inton. And from that meeting, the council and the college Gambia chapter is owing Paradise Hotel close to 1,800,000. Unfortunately, the chairman passed away of that chapter committee. He was my mentor and lecturer and my office mate. Had a sudden death, and then up to now we are yet to meet to see how best we can settle. We follow the ministry. It is the mandate of the government to in fact host that meeting, and then that West African College of Nursing was inaugurated in the Gambia here. And every 2 years they hold a membership, the congress, and then they hold it in different countries, and it's rotational. So basically the council for now is fully funded from the licensing and related services to licensing that nurses are paying. The council exam was $500 has been increased to $1,000 or so.
Yeah.
And then the ordinary exam, which were held between exams, was $1,000 has been increased to $2,500.
Thank you, Doctor. Thank you, Doctor. Thank you so much.
As a member of the council, one member, would you know how much they generated from this?
Yes, in fact,
it was appropriated, and then
sorry, one at a time.
Yes. It was appropriated, and then I think the budget that
no, he's not asking about that.
The charges.
That is what I'm saying. The budget was about 8 million plus.
How much do you generate from the charges?
That is what I'm telling you. The budget was about 8 million plus, and then all that 8 million was the charges were pegged at the budget. And then when we revise the budget, still we revise and then reduce, and then the 3 million plus is everything is expected to come from the charges.
You see, what they generate from the charges, the members we are paying, the amount council generates.
That is what I'm telling you.
No, not the budget. What they generate.
It was estimated.
No, please. If the chair talk, nobody talk, please. Order, please. He's asking a very simple question. You know, for the subventions coming from the government,
yes,
I will make a general comment on that. Now, what he's asking for, the charges, he's not asking for how much you budget for, like how much you are appropriating, how much you anticipate to have. He's asking for how much is realized, let's say 2023, how much does the council receive with regards to charges and fees or related, how much, just that, and the aggregate figure.
Yes, it may be.
Yes, Mr. Boy.
The fact that they don't receive any other source of funding. So the whole amount that they receive for 2023 comes from this service. But we are challenged to know the exact figure.
Oh.
That is the fact. Even during our meeting, they will not come and say, last year we have this amount. No.
So
that is the
fine.
So maybe to respond to 100.
Yeah, thank you very much. This one, I think, basically, it's more of we are talking about, like I said, the association. We will have an interface with the council. It's in fact part of our plan to have them with the public health and so on. But I just want to make this thing very clear. In 2023, we budgeted for each of the councils, four councils, I think it was 1.6 million. The 4 councils aggregate. Each of them is supposed to have, if you divide by 4, that's how much? Mathematicians, you can help, that's maybe each 400,000. 400,000. And we received a communication, sorry, Astaghfirullah. I received a call from, they had a meeting and they called me. I told them, no, this is not how it operates. Please write formally to the National Assembly saying that you have, since you have appropriated this amount from January to date, you have not received a budget. And I think they did that. So during the budget, we highlighted that, but like finance will always try to say it's the Ministry of Health who is responsible. But that one, it's not an issue as far as, I know it affects you directly, but it's an issue as far as we are concerned that we will take up with the finance and lot of the Ministry of Health. For 2023, it's pass and go. For 2024, they are budgeted for, and then we will take it up with the Ministry of Health and of course with the Ministry of Finance, because we cannot just keep on putting in figure year in, year out, whereas nothing is realized. That is our responsibility as far as we are concerned, to make sure that even if not all, because they operate based on cash flow and so on, we will make sure that we advocate for them and then we put them to tax to make sure some of those budget lines are realized. Yes, for that one we will take full responsibility and make sure we engage in the relevant authorities, the relevant concern, ministry rather, as a Ministry of Health. So, if you have any further comments on the other questions, then we move on to
just to respond to Honorable.
Just briefly, please.
Yeah.
Just briefly.
Honorable Caesar did ask about what is meant by motivation, because it seems to be an umbrella word. Actually, a case in point, for instance, is lack of equipment in our health facilities. A lot of the nurses work and they do not have the equipment that are required for them to work efficiently. And we know it is very painful in your heart. When you have a patient or client, you have the critical knowledge and the skills to care for the patient. But only to realize that the equipment you are supposed to use to deliver care is not available. Or the equipment has worn out. So you realize that a lot of them will complain to you that the environment, the working environment is very appalling and deplorable. Most of these equipment are not available. Another issue also is lack of drugs. A lot of them also complain across the country that there is no drug. They prescribe drugs, ask patients to go and buy, patients would vent their anger on them after paying their $25. So that also demotivates them very well. Because a lot of the patients come, trying to vent their anger on you when you are innocent, because your responsibility is to prescribe. If the drug is not available, you're going to go and buy drugs. So that also talks about motivation. A lot of them feel demotivated because of that. And also it's about the remuneration. That's the take-home message, for example. Now, a lot of them are complaining that the salary has been stagnant since. And now a lot of the things that they are surviving on, house rent, for example, your feeding, for example, all those have skyrocketed by pricing. So their earnings have not increased. So that has also served as a means of demotivation for them. So the other demotivation also is about the capacity building. Yeah? A lot of them are being challenged with scholarship, acquiring scholarship. Some of them will have admission, but they don't have the financial means to pay for it. They also do not have any institution to apply for scholarship. I can understand the issue of saying paying for yourself and you wouldn't be granted study leave with salary. I think that is enshrined in the general order, and I don't think we can do much except you, the National Assembly, if you can help in that. Because according to them, if you have to pay for yourself, you are not entitled to a study leave with salary unless you have given scholarship by the government or government agency. So about the official report you are talking about, putting everything in order so that you can submit to the official. For us at our level, sometime last year we went on a nationwide tour where we had an interface with all the nurses in various health facilities, almost 80% of the health facilities, from Khartoum to Koyana up to Banjul. So we have our report here. We can submit the hard copy if you prefer. We have the recommendations, all the issues that emerge from the nurses and what they want. We also have the recommendation. However, we have submitted a copy to the minister as well, and also to the council itself, so that as our immediate line supervisors and also our stakeholders, if they can help us achieve these recommendations. But I think it's also important for you to have a copy. That was why we deemed it necessary to print a copy for you.
Yeah. Thank you very much. Thank you very much, Mr. Boy. Not for you, but thank you very much. And then I think moving forward, I know it will be difficult, like the Honorable Sister said, it will be difficult to have you every quarter, but at least maybe twice in the year, or at least once in the year, we should be having that. And then whatever report that you have, please always include it in some of the recipients. Yes, share with us whatever report that you have. But for this meeting, as I said, I'm not referring to the annual report. You can share with us. But if you go back, please just prepare something for us. Yes, share with us for the purpose of this meeting, so that we can have it also as part of our records. So moving on, please, moving on. Because Honorable Badi asked certain things, I think this other side too, they need to say something, especially in regard to graduate diploma. So.
Yes, so thank you very much for those questions. To begin with, the membership to APEHOC is open to anyone who is trained on public health, meaning if you do any public health course, you are fit to become a member. That's why in our membership we have nurses, we have medical doctors, because they have a background in public health. At the moment we have 405 bona fide members, meaning paying members, those who are paying their monthly dues. Of course, we have other members who are not bona fide, but we don't really count those because they cannot vote and they cannot be voted into office. Yeah, so regarding the issue of someone having higher qualification and earning less than someone with diploma, I think that actually started when certain categories within the Ministry of Health were allocated some types of allowances which could have been across the board. That is where it actually started. We've actually talked about that at length, which led to the sit-down strike of the public health officers, because certain allowances which we believe public health officers can also benefit from was designed and given to others, leaving other cadres, not only public health officers. Laboratory personnel are not benefiting from that. Pharmacists are not benefiting from that. And the contribution of all these different cadres is paramount in delivering quality health care. One component, health, cannot be managed or handled by just a single professional. No. It's a collective work. The work of a lab assistant is as important as the work of a nurse. the work of a lab assistant is as important as the work of a doctor, because the doctor will not know what is wrong with you if you are not being tested by a lab scientist. So that is where these discrepancies comes into play. Like when you will see someone, I mean, with a master's degree and someone with a diploma in nursing earning more than you, because of some of the privileges that were designed and given to that particular individual. So that is what I'm referring to. I think we've talked at length about that. So we go ahead.
Okay, thank you very much, Mr. Mara. You are disorienting.
I think the issue of scholarship, Mohammed, you had raised that. But
yes,
I personally had faced that. You can come again. Yeah. I think with the issue of higher education, I believe equal opportunity is given to all Gambians if you meet the qualification. It's the PMO scholarship that we usually prioritize civil servants. Because for my own undergraduate, I had started like 2 semesters before the PMO, before the higher education scholarship was announced. Even with recommendation from my immediate supervisor, I was not given. Others were given who did not even start. So I had to look for another scholarship from the PMO. Then the PMO scholarship was already given out. So I was informed that PMO usually prioritizes civil servants over the higher education. But I don't know what your experience was. And later on, we were given scholarship from PMO.
Yes, let me comment. The issue of scholarship, right now the PMO scholarship for the past 2 years was mostly limited to master's level. And we all know, I mean, very few people can apply for scholarship. You mentioned that if higher education is given scholarship, it's given on an equal basis to everyone. That those under the ministry should be able to apply through the ministry to higher education. But there is no such channel right now. If there was such channel, we will all write to the ministry and the ministry will forward it to higher education. But right now, if the scholarship is open to everyone, what we are saying is a nurse or a public officer stagnant in URL for 5 years, not being able to forward the education, not because the person has the money, the person has the educational qualification, only because the person doesn't have a scholarship from higher education to study. And when the person applies with someone who's not even working for the government, the person who's not working for the government is given the scholarship while this person is stagnant in URL, denied the opportunity to come and advance himself. But advancing civil servants have a very big importance. That is, they further than to provide better services to the public. Civil servants are the only people who go and have all the opportunities to come back and serve the public again. So giving those people priority, whether through the ministry, whether through your recommendation to higher education, will pay dividend not only to the general country, to the country in general. But people come and study here and they go back to URL. But someone who is not even employed in the government, you give them scholarship, they go to America. Nurses who are mostly sponsored by higher education, who are not civil servants, usually leave. It's the civil servants who know that, like Dr. here, the love for their country, they stay. Some of them even go as far as you are. For some, in fact, they are sponsored by higher education. After completion, they are posted in remote areas. They refuse to go. They resign. Right? What I'm saying is, through your intervention, because no such channel exists, so through your intervention, you should be able to speak to either higher education or Minister of Health for all the people who are due for studies. Let them be channel be created so that they can be given priority. If they are health workers, they can be given priority to get scholarship to come and further their education so that they can provide better services. Because if you go to places like you are, there are more Indians than trained nurses. Because all the trained nurses, you spend there 2 years, you want to come out to the government, want to play with you, you resign and come here. You follow your studies and go for private. And that is happening to even public officers now. Because in the government there is less pay. And they come here and sponsor directly 12 students, although we are all Gambians, but they don't go to Basse. Some of them, you tell them to go beyond, they are crying. And some of us have been there. Myself, I've been to Gambia for 2 years. I am back here, still now no scholarship. I have to forgo off my studies. And my intention is to complete and go back. But how can I provide better services if I'm not given the opportunity to sponsor myself? And even if I sponsor myself, PMO will cut my salary.
Thank you very much.
And that's the recommendation as part of the improved working conditions for civil service. We know civil service is not just a pay, but there are certain packages that keeps the morale of the workforce. So this is one of the recommendations that we have already.
Thank you very much. What we will humbly ask, or honorably ask from you in this regard, please, as I said on this side, put everything in writing, and let's see how it goes, please. But again, the annual reports also is applicable to you. Whatever reports you have, if you are sharing with your other stakeholders, please do not forget that, like my Honorable Vice will always say, National Assembly is the center of problem and is the center for solutions. Yes, all problems come here and all solutions come here. So anything that you have, please always share with us. Before I give the floor back to others, Honorable Malo, you said you have something to say.
Yeah, thank you very much. First, I want to start with the issue of scholarship. There is a scheme. People have to understand that the youth components, the age bracket, we complain to government, and then the government is trying to have only 1,000 scholarship, and they divide it with this. People have to understand. We need to come up with a scheme. How long would you be entitled to giving a scholarship when you serve as a civil servant? That one have to be established, and we look at it from that angle. The other issues with you associations, we want to know your regulation functions. As an association, it's very important that your membership, you regulate them. We are interested in your report to know the functions of the associations. Because we are in the field, we know that some of our colleagues are not regulated. And then you want to fight for these people? You want people to do something, and you know the behavior and attitude of towards work is compromised. That one, the association need to have government in terms of the regulated functions of your association to your members. Adherence. You must set up standards. And that standards need to be adhered to everybody if you are a member. I am sometimes surprised if you look at the nursery schools that are coming. Are you not worried whether these people along the road are having a breach of the profession? What is the association doing going further? Because here, before we go and look your welfare, we want to look at your input to society. And that input to society will dictate government on the approach that they put to you people. And even our programs, the standards, ethics, these are all issues that we believe that at certain point in time, profession have lose their ethics, they lose their standard, they lose their code. It can only come as an association lot of. Let's look at if the public have this code to do, and they are doing it very well. They will design a scheme of approach for scholarship. Somebody have to work for 5 years. And the opportunity is when you go to the provincial Gambia, because people are not going there, at this certain time when you come, you are entitled for scholarship. So we want to know what are you regulating. We want to know your regulation functions, like I said, and adherence, that is the principle. Once we get that, it will give us a tool to be able to perform oversight on government. I want to stand here. If we go back to your payroll, I wish I was not in cabinet. If we go back to your payroll, some of the cadres are more motivated than other areas. And we will continue to do that. And that's very key that you know that this is something that we cannot compromise. And I went further to ask. He said to sponsor a science program, you can sponsor 3 other people. If I want to sponsor a public health in his program, there are other 3 people that can be sponsored on the monies that are going to be. Example, nursing or pharmacy. If you go to Iowa, those that go there, they know when you go there. So these are all issues that you people also have to look. And because the nurses are moving out, the public health are moving out, the people are moving out, how will we again give you the opportunity to read? Who is going to be there? You need to factor all these things. So that's why once you are doing what is expected, go back to payroll. If some of our colleagues understand that these are things based on nurses, because we want to keep you, we want to keep the public health. Any day you people strike, a major strike, the country is switched off. We don't want that. But also you people need to be genuine. I'm sorry for the word. You need to be genuine to the other people. That's the purpose of the association, like the welfare of the people. But the welfare of people start from what they are giving, what they are supposed to give. So on that note, I've not listened too much, but I have passion, and I've said, I'm sorry, Chairman, I said I am an ambassador in this assembly for the nurses. I'm sorry, public health. That's what I vowed, and I stand on that. And I believe that today, before you leave, there should be an ambassador for the public and environmental health.
Well, he's already here. The chairman is here.
Oh, thank you. Well, anyway, I declared myself.
Chairman is chairman. Chairman is chairman. No volunteer chairman. In leadership, we volunteer. We don't volunteer people. I know. But I'm saying you allow somebody to volunteer themselves.
Sorry, that's a very important question. So I want to give you the opportunity, at least 1 minute, so that I can share some of the, maybe like you asked, the regulation functions. I know when it comes to regulation with regards to law, it's your various council that is supposed to regulate your various functions. But as far as the associations are concerned, you also have a stake. That's what he is referring to. Don't mind sometimes the way he talks. You understand his language very well, especially me. But he is very right that you don't have an established and organized association like nurses and midwives, and you see your other colleagues do it otherwise, and you also keep quiet about it. Precisely, or essentially, that's what he's referring to. You understand the councils also are the legally mandated one. If a nurse misbehaves, the council have to punish you or whatever. But just 1 minute from the president here and from the president here. Just
okay, thank you very much, Chairman. Thank you very much, Honorable Mbalo. One of the regulation, I know obviously we are not mandated to regulate, but we motivate and then we try and rebrand and rebuild our image. Fortunately, when we organized our AGM, he was invited and he gave a speech. And then we recommended and rewarded 82 nurses for their excellence in service. So obviously that's a project that we intend to do every year. The most outstanding nurses in the country are recognized and then given something to serve as motivation. And not only that, when we see something wrong, we address it immediately. There was a post on Facebook, and then a nurse placed something on that FGM issue. And I call the nurse attention immediately. Can you immediately delete this? And then the person immediately delete and then apologize. And then I send something, a document on nurses' behavior and nurses' role on the social media. We have our strategic plan. We want to come up with a national nurses and midwives policy, but we cannot come up with a policy when our act is under review, because we don't know what the act will entail. If the act is reviewed and comes to you, and then you enacted it and pass it into law, and then it is enacted, and then we will use that act and have a national policy for nursing and midwifery, governing everything, and then we will be able to start. We want to develop a nurses and midwife code of ethics and code of conduct, but obviously that has to go in line with the act. So that is, we are constrained, but we are trying to do our best.
Thank you. Thank you so much. That was definitely a big response. And then we appreciate all the work that we are doing in that regard. Please keep it up, and you have our support in that regard.
Thank you.
Yes, Mr. President.
Yes, I thank you, Honorable, for those comments. I think what you talked about is a collective responsibility. Like they put it, it's not our mandate, but notwithstanding, as part of our aims and objectives, key among them is to make sure public health professionals behave in a manner that is befitting. And that is what the association, has been preaching all along. There has been instances wherein we mediated, not only between public health professionals and maybe outsiders, but even within public health professionals, because we know at various programs, at the health facilities here and there, usually there are instances of fracases between public health professionals. So to maintain law and order, to make sure the ethics are being adhered to, that is, of course, always been preached. And thank God, we have very active seniors among ourselves. But whenever things are about to go wrong, even before the executive will intervene, some of the social media handles we have, we have very active seniors in those pages. They will always put in their suggestions to make sure, we do not lose our way. So of course, we've been doing that, and we will continue doing that. But like I said at the beginning of my talk, it is a collective responsibility, and we as an association will always do our utmost best to see to it that our people behave the way they should. So that's all.
Thank you very much. And in addition, you can also work with your colleagues from the Northeast, and then also I know with regards to law, many times we'll have interface with the ministry. There are a lot of things that they need to do when it comes to laws, review, and so on. And then I have to tell you, even the Committee of Laws, we are frustrated a bit about that, because there are certain laws we can't just get up and change. We also have our limits. We cannot change everything, especially the laws that have to deal with taxation, alterations with monies, and so on, that have to come from the executive. The proposal have to come from them. Then at the end of the day, if it comes out, then we do it. But had it been some of these things can come in private members' bill, wallahi, I can even swear some of all of these things could have been settled by now, because we are aware. We know some of the challenges we are faced with, not the pharmacy, not the nurses, not the doctors, not the public health officers, lab, everybody is challenged as per when it comes to law. That's why when the lady there, Vivian, was talking about the public health law challenges, these are issues that we've talked about with the ministry and so on. But there's a process, they said there's a process, and they are reviewing some of this law. And then we hope and pray that the process does not take any further, maybe longer, so that it can come before us, because once it's come before us, like my boss will always say, consider it done. Yes, but that one I cannot show you that, consider it done. So thank you very much. Honorable Madam, you have got your environment.
So you only come to Bucha or
Yes, Madam. And we are, time is up.
Time is up.
Yeah, time is up. But you can ask your question.
Okay. Thank you so much. As you say, time is up. But anyway, I'd like to come to Madam Vivian, who mentioned about the act. So what exactly do you have when it comes to registration? Is it that there's this act that is preventing you people to register people, or what? Because when you mention about stateless, that one is serious.
Okay. What I meant was the requirements for registration. So there's an SOP, existing SOP, that should be approved by the ministry, the senior management team. So it has already passed the level of the registry of births and deaths, but it's still at that level of the senior management for the approval. And if the act also, the Public Health Act, is not revised and approved or pushed further, this particular bill, this particular SOP that is extracted from the CRVS bill will also not be enacted or approved. So that is also limiting people, because that is the SOP that we use for the work, the standard operating procedures for the work, the requirements that you need to get before you register your child or register your birth. So it's rendering some people stateless, because if you don't meet all the requirements, you don't have a document of identity. And the birth certificate is the parent document to all other documents you can get, the ID or the passport. So one without an identity document, without a birth certificate, is actually stateless in the context of the definition. That is my meaning. Yeah, that's what I mean.
Sorry, I comment to that gentleman Balde. Yeah. You mentioned like having like residential like a house or a compound, like for the staffs. Yeah. For this case, I think if this association is having that muscle, I think it is the responsibility of the association maybe to see this estate owners and then arrange for your staffs, how to get their compounds.
Well, it's going to be very difficult, because you will understand the association only collects $100 from 150, 100 from, let's say, first level nurses, and then 50 from second level nurses. And by virtue of, let's say, membership, you are automatically a member when you graduate from any of these training schools. But what happens is people don't reluctantly join this association, and then you would understand funding becomes something of a problem. And then, like the public health office, we are also doing a lot of other activities, because we have colleagues that get sick, which is inevitable, we help in their funding, overseas treatment, so we do all these packages, and these monies are coming from, some of the contributions that we make. And then currently, like my president has alluded, we don't have a secretariat. We bought a land at a tune of 1.5 million. You understand? We didn't want this money kept in the bank. So coming into office, we had that mandate that we are going to get a secretariat before our term ends. And then even if that is the only thing we are going to achieve as an executive, we will make sure that happens. So we bought that land, but processing the documents is what's pending. So you would understand with this, by virtue, we cannot go into any agreement with estates. But then the Ministry of Health as a parent body can help us with this, because we sign a bond with the ministry. They have our monies. There is a contract. They pay us. They know how much we are earning. So if they have these packages, we could apply. Anyone that feels it befitting to go to the ministry would make a decision with them. Perhaps 25% of your salaries will be paid to your house allowance, and then you will be given a house. So by the time it's 10 years, 15 years, you would have already been into your house. Or what can happen is ministry can look at a 50-50 stake with their employees. I pay 50%, they pay the rest. So I think all these are things that would help motivate staff. Because I don't see motivation as just money. Yeah? Because if it is money, you give me $10,000, I have 10,000 problems, worth of problems by the next month. So at the end of the day, the money is not going to quench all my problems. But then shelter is very important. I've worked in the most remote parts of the country. My Secretary General was a neighbor. He was my staff. The president here, we were in the same place. We used to cramp in the same bed. You would understand. So it's like very difficult. We were in Fatoto together. Fatoto used to be the hardest hit. But then when we were there, we made a pledge that we were going to do something. We ensured that we used the RDF money to build a fence in the facility. That was one of our greatest achievements. You understand? But then the problem we had is, he didn't speak of his part, but he had problems struggling with education. You be in the bush, you want to come and study, you're not given the opportunity. People around the combos, you just hear them, I'm going to school. Initially, what used to happen was, when Auntie Margaret was the CNO, she knows every nurse in the bush. When it's time for you to study, the person at the bush is brought to come and study. The person here would be asked to go and do whatsoever, because maybe during postings there were some reluctance. So that was how they were motivated. But now, it's people around here get the news, spread the news amongst themselves, and then enter the schools, get the fundings, get the scholarships, when people at the bush are not having anything. Personally, I was in Bansang for 4 years. Came back, did my midwifery. Catapult to Fatoto. I worked in Fatoto, I worked in Yarobao. So I've been there, I know what happens there. Yeah? So I didn't get the chance to come and study until after 4 years, when I had to make some push to come back. When I came back, I get the chance to study. So I think these are things that are so demotivating and don't help.
Yes, very fine. Unless he
Yes, good afternoon once again. I have a concern, which has regards to the council. Fortunately for me, I'm also a member of the council, that is represented by my region. And as the question you ask is a question that is always asked by us. How is the council audited? And who are responsible for the auditing of the council? And also, how often does the council meet with the member of the parliament? hence the council is the act of parliament, and we expect that the council is coming here and meet with you people. And if after all there is any increment that's supposed to be done by the council, it should first come to this parliamentary, discuss together, and then we can come to the council and also come to an agreement. But like the increment, it came at a point in time where nurses are complaining that the salary is stagnant, there is no increment in the salary, and the nurses working at like the farthest place for total. You ask the individual to pay $5,000, and the families here, the family doesn't have any residence, they are renting, and they have kids, they have feeding. You know that, sorry, we all know that the feeding cost has skyrocketed right now in the Gambia. So I think for your people, for your part, sorry, we like you to call the council and try to have an in-house discussion with them to come to terms, because for our nurses, they are not happy. Even with this case for $2,000 and $1,500 they're supposed to pay. And before it goes out of hand, because it's nurses, and now, you know, when they start something, everyone will say, we are not doing it, we're going on a strike. And it's illegal for a nurse to be in the field, not paying your license, or you doing your license and then practicing. If anything comes up, the council will not back you. But before it comes to that, we feel like you as a representative, sorry, as a body, legal body, should call upon them and then help us with that.
Thank you.
Yes, thank you. That's
Thank you very much. I think that is very positive. It's very positive. Then, just by information, we used to have engagement with them, but of course, with regard to their audit and finance, usually they're supposed to go to expert. But I think there's an arrangement that we will discuss within ourselves to see. It's a concern, and concern noted. We will take it up. Yeah. So, Honorable.
Yeah, thank you, Chair. It is not easy always to talk last, because all the points that I wanted to come up with, I think most of them have already been asked by members and also concerns raised by members. But notwithstanding, I think for the purpose of clarity and also for the purpose of the record, it is important to know that as Parliament we are not policymakers, but instead we are lawmakers. So that is why we are the apex authority that is given the powers by the Constitution of the Republic of the Gambia to perform oversight function to all government institutions, including the Office of the President. So that is a clear manifestation of our function as Member of Parliament. But going further, I want to commend both President from both associations for briefing and also sharing your achievements, the challenges, and also the way forward in terms of the work that you do as an association. But I think it is also very important if you give us such information. For example, if you talk about nurses or individuals leaving the work to travel outside the Gambia, it will help us as parliamentarians to know the statistics. So there is where the issue of data comes in. It will help us because we cannot go to plenary, talk about issues pertaining what is going wrong within the system when we don't have clear or specific information about what is really happening. So with the data, it will help, because if we know, for example, that 20,000 nurses have already traveled outside the country, it's a concern and it's alarming. So I think these are things that we must try by all means to be giving out information, so that at the end of the day, us as Parliament will make good use of it. The other thing has to do with the issue of the Act, which both members already asked. I think it is indeed a concern, especially when it comes to the charges, when it comes to, if you go to look for birth certificate, 12.50 butut is at a very low side. But it's important to see how best it can be revised. But like the member, the chair have said, as Parliament, when it comes to such law, we cannot bring in private member bills. It should be initiated by the executive. And through you have to engage the executive to see how best that act can be revised and bring to Parliament, so that at the end of the day we will do the needful. Like the chair have said, I will keep on saying it, the Parliament is the solution house. Because As the saying goes, a problem that is not solved is still a problem. But a problem that is solved is no more a problem. So that is why we are here. We are here to address the needs and the concerns of the Gambian people. And in doing so, it is part of our function to do the needful by making sure that we legislate and make sure that good laws are put in place. And not only put in place, but are implemented accordingly. Because that is where we fail also as Gambians. You will come to realize that we have a lot of good laws in this country, but the issue of implementation. Because we can be talking about the good laws that we have in this country, but when it comes to the implementation aspect of the laws, it is something else. And this is something unacceptable, and us as Parliament, be rest assured that you will have our support to whatever endeavor you have towards the progress of the healthcare system of this country, and I believe together we can do it. Thank you.
Thank you very much. Thank you very much. Just explain now. So, in the absence of any other comments, because it's about like 12:30, but now it is almost 1 p.m. Just again, by way of reminder to both the associations, please provide us with copies of maybe sort of written reports I can take in this engagement. Highlighting. They can send it stuff, okay? Yeah, you can send it via email. You can get the secretary's email just to save time and save cost. You can send it via email to her, and then highlighting some of the activities you do, and challenges, and maybe possible way forward. Because we are most interested in some of the issues that you are highlighting. Because for me and to everyone here, we feel that we are talking to the entire general nurses of the country, and entire general public officers of the country. We've been to the field, we know how some of you feel out there, and then even when some of you speak, you can hear that there is some, like it's a nurse or a public officer speaking all the way down to the, from the provinces or even somewhere in the campus here. So definitely, whatever that you give us here, we really cherish and appreciate it. Yes, I think basically that is it, because I wanted to comment on some of the legislation, but please highlight all these things in your reports. And again, as a way of reminder, your annual reports, please, maybe if you have quarterly or whatever, please just always be sharing with us. It will do good to some of the issues that we have to deal with. So thank you very much. In the absence of any other thing, we really appreciate your comment. It's one thing to be called and it's another thing to be answered. So we appreciate your comment, appreciate all the comments and then the concern that you've raised here. And as I always keep reminding people, if you come here, feel free to tell us anything you want. There is nobody, there is no competent body as far as the Republic of the Gambia is concerned to question anything that you share with us. And if anybody does, please do not hesitate to get back to us and we will deal with that individual or body. Because we are protected by law, we are protected by whatever. You are immune, but once you step out of here, please you are returning back to your normal portfolios. Follow the GOs and also follow your supervisors and whatever. But see, once you are here, say whatever that you want to say, because you want the reality, you want the facts. So thank you very much, and then you are released, the meeting is closed. Thank you.